Hydroflux, redefining your lifestyle, presents the return of the Singapore Parenting Festival. Join our amazing hosts in a series of 8 free webinars that cover fertility and pregnancy concerns, parenting tips for newborns to fussy eaters, living with COVID and vaccinations, and guides from preschool to PSLE. Register now and attend our webinars for your chance to get an exclusive SPF goodie bag while stocks last. The Singapore Parenting Festival is proudly brought to you by MediaCorp and the Asian Parent. Platinum Partner, 100% organic drip chicken essence with cordyceps. Gold Partners, Dumix Grow, comprehensive nutrients. Scott's Vitamin C for kids' immunity. Nature One Dairy, your partner in parenthood. PCF Sparkle Tots, we sparkle lives. And the following silver and other partners. Hydroflux, redefine.
All right. Hey, everyone. Thank you so much for logging in this Monday evening to join us for this very exciting webinar that we have as part of the Singapore Parenting Festival. I think we still have a lot of people coming in. So yes, please do tell your friends about this webinar if they have kind of forgotten. If you think that they're not online with us today yet, please send them a message because there are exciting stuff that's happening in today's webinar. There's a chance for you to win some vouchers, some goodies. All right. So yeah, get your friends to come join in this very informative webinar that we have some experts coming in, as well as some moms with experiences that they are going to share with you about their journey. So we do want to thank these sponsors as well as the organizers, MediaCorp and the Asian Parent, for putting this together for us. And if you haven't heard, the Singapore Parenting Festival is going to have a series of webinars, including this one that we have today. So don't miss out the ones that they have upcoming as well, right? For the topic that we have today, trouble conceiving, all you need to know, we do have some speakers, panelists, myself, and some moms, like I mentioned, Kimberly and Rohaida will be sharing our experiences with you. So again, we do have these partners that we have coming together to also, well, probably in the goodie bags if you're very excited about it. Okay, I hope that you can join us to the end of the webinar because there are some goodies that you don't want to miss. And a lot of you can actually be walking away with these goodie bags as well, right? So thank you to the platinum partners that we have, Hydroflux, Yirensen, the gold partners, Dumex, Scott's, Nature One Dairy. We have PCF, Sparkle Tots as well for the gold partners. And for the silver partners, thank you for Ministry of Health coming in, Baby Dove, Virtus Fertility Center, and Prudential. And for the content partners, we have Center for Fathering, Moms for Life, Dads for Life, and Baby Pass, right? So without further ado, we are going to move on to introducing, well, you've heard me talk a lot, okay? But firstly, we do want to just set a few house rules that we want you to be aware of. We have a question box, right? So please enter the questions that you have coming up once you've been hearing our experts and panelists sharing their stories, myself included as well. So if some questions do pop up, please put it into the Q&A box and not in the chat box. Now, there will be a panel discussion and the Q&A, so please save all these questions for later. All right, put them into the Q&A box. And we do have, like I said earlier, 6 lucky attendees who will win a $50 Shopee voucher each. I believe it's a no minimum spend Shopee voucher. So 6 of you lucky winners tonight. You have to stay to the end. The rule is you have to stay to the end because the winners will be announced at the end. So if you're not here, too bad, right? So I'm kidding, right? So the winners will be announced at the end of the webinar. And there are also a couple of goodies, like goodie bags, not couple, 150 of these goodie bags, right? So in a moment, you'll have the QR code. So please have your phones on standby, okay? Now, there is also a spin the wheel where you can win attractive prizes daily. So please have your mobile device with you, all right? Scan this QR code right here for the spin the wheel. And coming up in a short moment, you will also have another QR code to scan where you will receive, and it's only open to the first 150 of you guys, okay? So scan this QR code and you will receive a goodie bag. It really is fastest fingers first, okay? So please take your phone out, scan, tell your friends as well, because the first 150 of you guys will get a chance to receive this goodie bag, right? You heard the partners that we had earlier, okay, all very well known one, okay? So not saying that everything that I mentioned earlier, all the partners are going to put something inside, but a goodie bag is going to be, these goodie bags are going to be quite attractive, right? So please scan it, and you'll have another chance as well. If you didn't get it, you get another chance at the end of this webinar. So stay tuned, right? I've been yakking a lot. Who am I? I'm Dawn. Okay. I'm also known as that mom of four. Okay. Because I have 4 kids. All right. But I didn't have it easy in the beginning. Okay. I do have businesses that I run. So I'm an entrepreneur. I'm also quite active on social media where I share about my fitness journey, and how I actually keep fit, and manage my life as a working mom. So it did take me 4 years to conceive my first child. Like I said, I really didn't have it easy at all. So I'll share more with you guys in a moment, right? So along with myself, we do have Dr. Roland Chieng, and I'm so excited that he's on this webinar with me, because when I first saw his name in the list of experts, I was just dumbfounded, because he's actually the gynae. He's not just a gynae, he's the gynae who helped me deliver my 3rd and my 4th baby. All right. So thank you, Dr. Chieng. Can't wait to speak more with you later. All right. So his accreditations are, well, there's a long list there. Okay. So you guys can see he's been in this industry for a long time already. So he specializes in fertility preservation, both for male and female. All right. So he's the obstetrics and gynecology. He's an expert in obstetrics and gynecology and reproductive surgery, right, from Virtus Fertility Center. And we also do have physician Tan Pok Loon, Eric, who is a TCM expert with Yurensen, Singapore. So he graduated, that's my 5th baby, by the way. He graduated from the Beijing University of Chinese Medicine and has a degree in medicine, Chinese medicine, and is also from the Nanyang Technological University, where he has a degree in biomedical sciences and traditional Chinese medicine. So physician Tan is a TCM expert with Yurensen and acts as a consultant for them for their products and supplement development, imparting his TCM knowledge to the staff and public through trainings and courses. Right? And those are our experts. Up next, I want to introduce to you our panelists, starting with Kimberly Unwin, who is a mother of 2 with secondary 2 boys. She has actually suffered from secondary infertility. You can actually, she's actually one of the founders at Fertility Support SG. So if you guys go look up Fertility Support SG, you'll be able to find a support network, right? People who are on the same frequency as you. If you're going through, infertility issues, this is where you find your support, right? And maybe lots of new friends as well, right? So head on over and just join their group. Okay, so unlike most ladies, Kim, 37 years old. All right. Oh, wait, I'm not done yet. Kim has only faced fertility, has only faced infertility after conceiving and having her 2 boys. So this can happen actually, not just at the beginning, but even after you've had kids, right? So she faced secondary infertility, and after going through 2 IUIs and 2 IVFs, that's only when she found out that she suffered from severe endometriosis and a defect in her uterus. So she's right now currently undergoing surgery and treatment to fix that, right? So hope we hear good news from you soon, Kimberly. And we now have our next panelist, Rohaida. Okay, Rohaida Rahmat. She's a beautiful mother of 2 boys, also beautiful boys, but they're actually born via IVF, right? So she's also one of the founders at Fertility Support SG. That's where you can find Rohaida and Kimberly, and they'll be sharing their stories a lot more there as well, along with many other ladies who are going through the same things, similar things as you are, right? So if you're having difficulty speaking to people around you who don't understand, this is where you go to. So she has a background of structural infertility. She's lost both fallopian tubes due to ruptured ectopic pregnancies. It sounds very painful, yeah. Okay, so kudos to you, Rohaida, you're very brave. She's actually here to support other warriors, right, through this pain of their fertility journey, right? So it doesn't always have to end up, giving up where you see yourselves giving up. The journey may be a little longer, it may be tough, but with the right support, I guess, you probably will be able to have a really happy ending. Okay, so thank you, Rohaida and Kim, for building up Fertility Support SG for ladies here. All right, so let's move on with our webinar with our first poll. We want to hear from you. Help me talk a lot. Okay, I want to hear from you now. Okay, we want to hear from you now. So tell us, when it comes to fertility, your age doesn't matter as long as you live a healthy life. Is this true or false? So while we're waiting for your answers, okay, I can tell you I'm very active. I think the two mummies here also look very active. Okay, so you know, I think looks can be very deceiving. That's all I can say. All right, so let's see what you guys think. All right, and many of you, wow, there's a few hundred of you online already. Okay, so that's going to be quite a lot of thoughts. Hey, you guys, put the answers into the poll and not the chat box. Okay. We need your answers in the poll. So just click on true or false. So that's where we actually churn out the percentage of you who actually answered true and how many of you answered false, right? So if you typed into the chat box, can you please also share your answer with us in the poll box, right? So just click on true or false. Okay, so thank you so much again for everyone who has joined us for tonight's very exciting webinar. Okay, I think I'm really excited to hear really from Dr. Chieng and as well as Physician Tan. Okay, because I'm very interested in always learning a little bit more about how treatments can help people, and in this case with infertility. Okay, so I think that you're never too young and never too old to learn something, but with these two topics, you know, Dr. Chieng is from like a more Western medical background, and Physician Tan is from more TCM, but from what I heard you guys discuss, okay, it's more it's they run parallel, right? They can support one another. Ooh, okay, so poll results are out, and 26 of you said that is true. When it comes to fertility, your age doesn't matter. And then 74% said false, right? It doesn't matter. Your age doesn't matter as long as you live a healthy life, okay? Well, it says I didn't answer this question. I'm sorry. But your thoughts are what matters, okay? So thank you so much, you guys, for sharing your answers with us. I think we'll take this later on with the discussion that we have with the doctors, okay? So let's introduce to you guys our first expert who's going to be speaking with you, Dr. Chieng. All right, so Dr. Chieng, I would like to invite you to just share a little bit more about infertility with us and how it can be treated, you know, how you have together with Virtuous Fertility Center being able to kind of manage it, and what we can learn from this as well, right? So Dr. Chieng, over to you. I must say you still look the same, after how many years has it been? 10 years since? No, my youngest one is 6 now, so yeah, 6 years since I last saw you.
My goodness.
Yeah. All right.
Okay. Thank you very much, Dawn. Good evening, ladies and gentlemen. It is a great pleasure, my honor to be here. I'm actually very, very happy. I think the number of attendees we are reaching now, 380. My goodness.
100.
Wow. So this is very exciting. We really hope that everybody could pick up some pointers from today's webinar. And I think, you know, it is wonderful to have such a fantastic lineup with all the panelists. So I hope that I can give you a bit of my contribution. So I'm going to talk about all fertility-related issues, as well as what are the treatments, and also when is it the time that you might have to seek fertility advice or treatment. Now, I'll start off by defining what is infertility. Now, infertility has been defined as a disease now, as a failure to achieve a successful pregnancy after 12 months or more of regular unprotected intercourse. Now, you might be wondering why it has to be 12 months. So it has been done, you know, enough on the statistics part. 85% of normal couple are pregnant end of 12 months, and 92% pregnant at the end of 24 months. And after that, you don't get any further increase. Now, if you look at the statistics there, what it means is that at the end of 24 months, there is only 8% chance that you are just pure unlucky, and so therefore the chances of something going on might be higher. Now, I'm going to structure my talk this evening. We're going to talk about what happens in normal conception, what could go wrong, what your doctor can do on the treatment part, when to seek help, the different assisted reproduction techniques, and when is IVF necessary. Now, what actually happens normally is that you have your ovulation or the release of an egg coming from the ovary at one end of the fallopian tube. And this egg, after being released, immediately will be fertilized by the sperm that's around here. And after fertilization, the fertilized egg, or what we call now embryo, will slowly move along the fallopian tube. And at the same time, it will continue on with this development. And at the end of usually about 4 to 5 days, it will reach your womb cavity, ready to be implanted. So that is what is happening normally in normal conception. So with that, I usually want to start off by discussing infertility with the infertility indicators. So infertility indicators, there are 3 main things that we're talking about. Of course, one of them is the sperm coming on this end. Next, the egg must be released. And of course, the connection between the sperm and the eggs must be intact. So therefore, we are talking about the fallopian tube. So with that, what are the causes of infertility? We define as mainly the 3 main factors here: the male factor, ovulation factor, whether there is a pelvic factor such as fibroids, cysts, or whether the fallopian tube is okay. And of course, there are also discussion about endometriosis-related infertility, as well as unexplained, which is usually defined as when all 3 factors were all normal. And of course, now we have our new issues, the age-related infertility.
Yeah, I think that one is a very hot topic when it comes to like fertility these days. I think people are waiting till much later now, right? Is it true, Dr. Chieng?
Yep. That's so it is a new challenge that we are facing now. Now, in order to discuss about the age-related infertility, I would like to first talk about what is natural fertility. Now, fertility, of course, is a physiological potential to produce offspring. However, in different persons, different individuals, it's very, very different. Some are more fertile and others are less so. So we know very well that people around us sometimes, they stop their contraceptions immediately. Soon after they get pregnant, or somebody who took a bit longer to get pregnant. So therefore, everybody is slightly different. However, there isn't any measure or indicators for how fertile you are. So this is the most difficult part, because if we all know that we are very fertile to start with, then we do not have to worry about our decline. So age, in fact, is a major determining factor. So if you look at your peak fertility, which is usually at the age of 24, 25, this peak fertility is halved at about when you reach age of 38. So that's where the main issue is, because if your natural fertility is not that high, half of that you could be in trouble. Now, this doesn't make it any easier, because the current trend, we have a very disturbing trend now. We are all very common to delay starting a family. We can see, older mothers who are trying to conceive. And also, people are getting married late, mainly because of career, education demands. Some might want to have a bigger house, financial stability. Some feel that the relationship are not stable enough. And also, there are many couples now, from the very beginning, they were actually together quite early, but they will say that, emotionally, they are not ready in the beginning, but sometime later, they wanted to have a child. So that's when it becomes difficult, especially when you're older. Now, this is a chart, it's a common chart that is shown to illustrate that point. If you look at the red line, it indicates the likelihood of getting pregnant, percentage on this end, and this is the age of the woman. So it keeps going down. And of course, the likelihood of infertility going up correspondingly. Now, we talk about those few factors that we have. So first, let's talk about the male factor. Now, semen abnormality, you can see, I think all of us are very familiar. You can see that you are being told that your sperms are not normal. The normal percentage of your sperms is very low. So this is a real microscopic picture to show what sperms looks like under the microscope. But of course, there are a lot of possible different shapes, abnormalities of the sperms, and a lot of these are actually not able to fertilize an egg. However, you might think that it is a big problem, but it is not much of an issue, because you see, if you look at the semen analysis, the concentration is usually in the range of millions and millions. So we talk about more than 60 million per mil to be normal. So you don't really need all the sperms to be normal. So we talk about male factor, we usually define from the aspect of a semen analysis. Semen analysis will show us mainly, number one is the concentration. So we have a various degree of severity and the likelihood of producing spontaneous pregnancy. From the most severe, azoospermia means you can't find any sperm. Of course, the possibility of getting pregnant is near impossible. Down to severe oligospermia, 0 to 2 million is very, very unlikely. Oligospermia, however, this is not so much of an issue. We have seen enough parents whereby the sperms are in this range, but they are all having children. So main issues are azoospermia and severe oligospermia. However, when you talk about motility, most of the time, motility is not much of a concern unless if your motility drop below 20%. And that's when the chances of possible producing pregnancy will be lower. Now, similarly, morphology. Morphology indicates most of the time in terms of structural damage of the sperms. And if let's say if it's less than 1% or 0%, then the chances of producing spontaneous pregnancy becomes very unlikely. But of course, we have a lot of borderline quality, which here, the chances of producing pregnancy is still very, very possible. So in a way, I always say that the check on the semen analysis is not really necessary. It only means something after you have been trying for a while. Without any success, then only the semen analysis would mean something and will be able to interpret. Now, when it comes to treatment, it is a sad situation. Unfortunately, male factor, when you talk about treatment of the sperm, it is very, very disappointing. And in fact, if you look at all the male factor, as I mentioned earlier, only 12% of all those are really treatable. And majority of them the treatments are extremely controversial. So that's why when you talk about sperm treatment, there are multiple, methods that are being used, vitamins, herbs, acupuncture, or whatever you have you. But the most effective treatment, how long it has to be, and whether there is any improvement or not, because I think we are dealing with another major issue about semen analysis is that semen analysis frequently will encounter wide fluctuations in the results. So it is very, very difficult to determine whether a certain treatment is considered effective or not. Now, next, we talk about ovulation disorder. Now, ovulation disorder, most of the time, if you have somebody who has very little menses, meaning the menses that does not come very much, maybe once or twice a year, or longer than 2 months, then the chances of ovulation disorder is higher. Now, ovulation disorder is probably quite amenable to treatment most of the time. We have medication for induction of ovulation. I think we all know about the popular medication that's being used, the Conceiving, as well as the injections of FSH and all that. Now, ovulation disorder frequently is linked to lifestyle. So let's say you are overweight, then the change of a lifestyle to reduce your body weight sometimes actually make ovulation better. Then, of course, the insulin sensitizer, some of the medications that have been used, such as metformin, and sometimes as well, that I'm sure we heard about this condition called, this operation called Ovarian Drilling. So operation is also have been used for ovulation disorder.
Dr. Chieng, one just very, very quick question. So when a couple goes to you, do you automatically just test both the male and female?
Yes. So for all couples when they're coming forward to treatment, we look at all the above mentioned factors. And, I usually ask couples to come together so that we can assess as a whole. Now, moving on, the other thing is, of course, the pelvic conditions, pelvic factors, and one of which whereby we are particularly concerned is the fallopian tube. Now, fallopian tube condition or tubal diseases is getting extremely rare now. This usually occur because you have any previous pelvic infections or any previous operation that has causing scarring of the tube. But by and large, the previously we encounter mostly the tubal diseases are due to infection. Now, when you talk about tubal diseases, of course, the treatment is usually by operation. However, most of the time, even with operation, you're only able to achieve physical patency, meaning the tubes are through, water can run through. But as you can see earlier, when I talk about the normal conception, the fallopian tube is actually more than just, a bridge, a conduit between the sperms and the eggs. It has a lot of functions in the nurturing of the early embryo, development of the early embryo. So a lot of the time you might be patent, meaning water can come through, but the function-wise is not there. So most of the time after treatment of tubal conditions, we will allow spontaneous conception for a short while, and then you will need to consider IVF if it's not successful. Now, other pelvic factors we talked about earlier, such as uterine fibroid, this particular fibroid will be of main concern, fibroid in the uterine cavity. This is a uterus cavity from inside. When you put a camera through, you can see the inside of the uterus. And this is a fibroid that, protruding into the cavity. So this is the type of fibroid that usually will affect conception. So these are all amenable to operation. Now, the question is, we always wonder, when is it appropriate to seek medical advice or tests? When do you need to go for tests? Now, of course, as what we define about infertility, when you have regular unprotected sexual intercourse for 2 years, in the absence of any known pathology, or if you should seek medical advice if it is earlier if you have the following factors. When your age is approaching 35, when your menses is not coming too often, indicating some kind of ovulation issues, when you have severe pain during menses or any previous pelvic infection or any previous abdominal operation, all these are possible reasons for any tubal scarring or tubal conditions. And of course, if you have a long history of abnormal previous sperm condition. So if you have these conditions, it's probably not appropriate to wait for 2 years, especially if you are older. So you should probably, seek medical advice maybe after 6 months or so with unsuccessful conception. Now, when you come to your doctor, after all the checks, all the different checking and all that, what are the things that your doctor could do? Now, one of the things that could be offered is IUI or intrauterine insemination. Now, this is a treatment technique whereby at the right time of ovulation, with the scanning, blood tests and all that, whereby we determine that you could be about to ovulate, we will take the semen sample, prepare it in a laboratory and put it through a tubing in the uterus. So therefore, with that, you have a certain requirements for this procedure, and that is you must be ovulating, whether you are ovulating under treatment or ovulating on your own. And of course, the fallopian tubes need to be normal. And the other condition is that the good sperm function must be good. Success rate is very, very variable because different people go for IUI with different indications. So generally quoted as about 15 to 30%. But if I say there is no clear reason such as poor sexual activity, poor ovulation, the success rate could be much lower. Now, additional benefits over normal sexual intercourse could be there because I think nowadays in Singapore, our couples are all very busy. So with this timing for IUI, it might be beneficial because now you are more aware of timing. And so therefore, with the intrauterine insemination, it might be helpful. Cost is of course a lot lower depending on whether you are using medication, and it can range from about $500 to $3,000. Now, compare that to IVF is extremely different. It is completely different because basically the fertilization process is still within the body, but whereas in IVF, there is a process of egg collection from the ovary, and this egg is being injected with a sperm to ensure fertilization, and thereafter the embryos is being passed into the cavity at the right time to ensure implantation. So by doing that, you really bypass the entire fallopian tube. Okay, so that's IVF. Whereas intrauterine insemination, IUI, it is quite natural. Instead of comparing to your normal sexual activity whereby ejaculation is in the vagina, you actually prepare the sperms and put it up in the cavity. Now, those are all the treatments available. But I think I always emphasize on, if you are trying on your own, what are the things that you need to look out for? How to optimize your chances of spontaneous conception? So I'm going to touch on some of these factors. So first, the sexual activities. How frequent do you need to have sex? Now, it is widely believed, in fact, that frequent ejaculations could actually decrease your sperm conditions. Now, that has been proven not to be so many times over. In fact, if you look at men with normal semen analysis, with daily ejaculation, the quality remains the same. In men with low counts, with daily ejaculation, the counts and the motility actually improve.
Oh, that's very interesting. I never knew that till now.
Yeah. And so how frequent it is? So the general advice is that daily sexual activity seems to be all right. And of course, if you look at the further surveys, it has been found that with daily sexual activity, you can get about 37% pregnancy per cycle. Alternate days or every other day, 33%, quite similar. Once a week, it drops to 15%. So with that, the usual recommendation is that you know that your chances of conception will be better with frequency. So therefore, you have to have more frequent sexual activity as much as you can. Sexual intercourse every 1 or 2 days seems to be the best. And of course, the most important here is that we do not want to have a very strict schedule and own preference. But of course, your own preference, if it's once a month, is not okay. Now, next thing we touch on is a fertile period. I think this is a favorite area whereby people talk about, how to determine when you are ovulating. And there are various methods that has been used, looking at body temperature, cervical mucus, day counting. Well, they are quite accurate in a way, but of course, it all depends on what is your natural menstrual cycle. It is definitely not reliable 100%. And I think the main concern is that when you are monitoring, you are inducing unnecessary stress. Now, if you look at the menstrual cycle, again, we are back to this picture to look at what actually happens in menstrual cycle. For somebody who have a 28-day cycle, you will have a menstrual cycle like that, whereby there will be 14 and 14. 14 days for your surge and another 14 days for your menses to come back again. However, if you look at the situation whereby somebody might have a longer cycle of maybe 35 days, the 35 days, out of that 35 days, you minus off 14 because this part of is rather constant. And so therefore, your ovulation actually occur much, much later. So it's no longer from, what usually happens at 12 to 14 days in a 28-day cycle. All right, so you probably ovulate 1 week later. You can go up to about 20 days before you ovulate. However, the other issues here is that you can actually sense the surge. You can pick up the surge by doing body temperature testing and all that, and also the test pad LH kit. However, when you ovulate, it is going to be a very, very tricky issue because this varies a lot. It could start from 24 hours after the surge all the way till about 48 hours. So it is a wide ranging. And so therefore, if you want to pinpoint the exact time when you ovulate, it's going to be extremely difficult. Now, it doesn't have to be so complex. So the most usual advice I give to all our couples will be just to look at your secretion. If your secretion is moist, initially slippery and clear, that's when you have not ovulated yet. But the moment you have ovulated, you'll find that your secretion will be much reduced and it becomes sticky and maybe a bit thicker. So that alone is already sufficient for most of our couples' situation. Again, if you look at the chart, just to tell you that throughout the whole cycle, menstrual cycle, any time that you have sexual activity, it is possible to produce a pregnancy. So this chart indicates a single act of sexual activity, what's the chances of conception? And of course, this chart tells you, assuming that you have day 0 here, whereby ovulation happens, the chances of pregnancy is best if you have sexual activity, maybe about starting from about 1 to 3 days before the actual ovulation. Once ovulation had happened, then the chances start to drop. Now, next are coital habits. I think we know we all like to talk about, after sexual activity, you should be lying in bed for 2 hours with your pelvis tilted upwards, not in another position. Yeah. So, people like to talk about this, but in actual fact, there is no basis, there is no scientific basis for this. It has been all shown to be unnecessary. Whether you remain supine, pelvis tilted after sexual intercourse, certain coital position are all not important. And whether you have achieved orgasm, does it improve your fertility? The answer is again no. And coital practice, whether it becomes better for a certain infant gender, again, there's no basis for that. So don't have to worry about coital habits here. Sorry, Don.
Definitely eliminating a lot of those old wives' tales and what people have said that has no scientific proof at all.
Yes,
so thank you so much for putting all this in. But
so,
Chieng, we need to speed up a little bit.
Okay. In fact, I actually told our couples that immediately after a sexual activity, you just move on and go for a run. So that will be better for you. The use of lubricants, commercially available lubricants and all that. So there are some emphasis on using pre-seed. Again, that's not really necessary. In fact, I will say that any lubricants will do. Now, next we talk about some of the lifestyle factors. Some of these apply to us, some not so much, especially smoking. It affects infertility a lot. Obesity, caffeine, alcohol, not too much, but it is a factor here. So mainly our body weight and of course smoking. Now, smoking, it has been found women who smoke more likely to be infertile. This is about odds ratio of 1.6. And menopause occurs 1 to 4 years earlier, and even the risk of miscarriage is also higher. And IVF success rate generally reduced by 50% in smokers. So, conclusion for natural conception, what's best? Age does have a huge impact on fertility. You need to be aware of your infertility indicators, and if they are present, you might want to seek advice earlier. Frequent intercourse every 1 to 2 days is best. The fertile window, 6-day interval ending on the day of ovulation. So it could be as long as 6 days. It doesn't have to be on the day of a supposed ovulation. Specific coital timing, position, resting supine, certain positions are all not significant, when you talk about enhancing fertility. And if your menses is regular, frequent intercourse soon after your menses is enough to maximize your chances of getting pregnant. And devices to determine the time of ovulation will be useful for somebody who has irregular menses, but otherwise it's just unnecessarily induced stress. And smoking need to be discouraged for all couples trying to conceive. Now, just going to briefly touch on when it is advisable for IVF. Now, IVF indication has largely changed over the years now. So I always believe that it's not just the age, it's not just your conditions, but it's in fact probably more important if you look at the duration of trying to conceive. So there is a possibility as you try longer, the age effect starts coming, and of course the emotion effect. Now, for most couples, 6 months of intensive trying to conceive is already enough, because thereafter the emotion factor is just so high. Now, what about medical indications and previously unsuccessful treatment? If you have any possible male factor, tubal factor, pelvic factor, ovulation factor, if let's say you failed treatment for a while, 3 months, 6 months, you might want to consider IVF already. And of course, there are some patients who require PGD, which is pre-implantation genetic testing for normal embryos to be used. And these are the conditions whereby you actually have a known genetic conditions that you need to avoid. However, there are people now who are doing IVF for recurrent miscarriages because you want a pair of twins and you want a certain gender. Usually this is not encouraged. Now, emotional stress in infertility is huge. We have a dedicated counselor who are full-time in helping couples to deal with this stress level. Now, trying for pregnancy is extremely difficult. Now, I think for most people, the definition of trying, what does trying mean? Trying basically means they stop doing the withdrawal method, or they stop and then now previously they've been withdrawing. It is not really so. Ovulation test kit, now that they're using the test kit, and that means they are trying. Not really so. In fact, trying for pregnancy, as long as you are not having an effective contraception, you are considered exposed to possibility of getting pregnant. Now, take infertility treatment as an exercise to discover. This is what I encourage all couples when they are embarking on infertility treatment. Infertility treatment is just an exercise to discover whether you are going to be successful or not. And your chances of success is yours only. There isn't anybody else involved. Statistics, what's your chances of success is only for the paper record. Your chances is only yes or no. And of course, the importance of fertility counseling and fertility coaches. Now, IVF success, we look at primarily age. The older you are, the less successful you're going to be. If you have previously been pregnant, the chances of success will be higher. If you have any medical indications, such as male factor, it was going to be more successful. If you have previous IVF failure, your chances might be slightly lower. And of course, ovarian reserve, the better you have, the higher the IVF success is going to be. Now, IVF is by and large considered quite safe. The complications for IVF are actually quite, outdated. In the old days, we were worried about multiple pregnancy, OHSS. Nowadays, with enough interventions, we don't get multiple pregnancy anymore. Twin pregnancy is relatively rare. Safety is quite safe. The medication used are all well tested, and we hardly have any drug reaction. And the procedures of egg collection are all very straightforward. Takes about 5-10 minutes or so. And of course, embryo transfer and all that. Embryo transfer is even safer. Now, we usually have sedation for the procedure, and therefore you will not feel too much of discomfort. Now, long-term effect of IVF, whether there is any cancer risk, whether there's any risk in the IVF children. Now, all this has not been proven. By and large, today, it is still okay to proceed. So I usually emphasize on the IVF step-by-step, whereby you are starting medication, injection at the time of the menses, with blood test, ultrasound, and your medication will go on for about 10 days with egg collection on day 12, followed by egg collection, and then you will have blastocyst freezing or embryo freezing, and you'll be reviewed at the time of the menses about 1 week after the egg collection, again, ultrasound blood, and then we'll be starting some medication to build up the lining. 10 days later, we look at the lining, everything okay, we go ahead for the embryo transfer, and you have your blood test for pregnancy 2 weeks after. Thank you very much. That's all for my contribution this evening. Thank you.
Well, thank you so much for those insightful sharing, Dr. Roland. Can you all hear me clearly? Oh, good. All right. Awesome. Thank you so much. All right, Dr. Roland, I thought I knew a lot already about biology, but you just really enlightened me once again. All right. So thank you so much. I think a lot of the attendees as well, they were saying that, this is really informative. And thank you so much for putting together the slides and sharing with us a little bit more about how, the process is, right? So it's really quite complicated, and things can happen along the way that can actually stop all this, baby making plans, right? So I think the best thing, something that we also need to know is really gynecologists are different from fertility experts, right? So Dr. Chieng happens to be both, all right? So we have really a lot to learn in both aspects of that, right? So if you guys want to find out more, okay, you can actually download this scan this QR code right here, and it's a downloadable version of the before baby pre-pregnancy guide, how you can prepare yourself, that you can actually learn a little bit more about to prepare yourself on this journey to, having kids, building your family, right? So do go ahead, whip out your phones and scan this QR code, download that PDF, or download that the pre-pregnancy guide from Virtus Fertility Center, right? So thank you so much, Dr. Chieng, once again. There are many questions that came up, and we're going to save that for later discussion. But before we open up the panel discussion, all right, we are going to want to hear from you once again, all right? So tell us once more, all right? A woman's fertility starts to decline when she is about 25, about 32, or about 40. What do you think? Right? At what age, right, does a woman's fertility actually start to decline? You can only choose one, right? So let us know what your thoughts are. I personally did try to start early, and it didn't happen till a while later, but I also want to share, like, just never give up. Later on, like, what with Kimberly, she'll share your story, she'll share her story with you as well, and Rohaida as well. So we do want you to just don't give up so easily. There are things that you can still do. There are resources that you can still reach out to. And like I said, the story might be very different. Okay. So yeah, answers are out. Your thoughts are out. About 30% of you said that at about 25 years old, women's fertility starts to decline. 47, which is the majority of you, said about 32, and 23% said about 40, right? So thank you so much for sharing that. I think we're going to hear from the experts as well, like, around what age is it that women's fertility really starts to decline? You're going to hear from the experts, right? So let's hear next about conceiving from physician Tan, or physician Eric Tan, who's a TCM expert. And he's going to tell you a little bit more from the TCM side of things, how conceiving can actually be assisted with TCM, right? So over to you, physician Eric Tan.
Hi, good evening. Thank you, Dawn. Good evening, ladies and gentlemen. Having already spent quite some time achieving some knowledge on the Western aspect of infertility, let me run through some of how TCM view fertility. So let's go into the roots behind the cause of infertility. In traditional Chinese medicine, we see obesity as one of the very main factors that affect fertility. So how does this obesity, like as just now Dr. Roland also mentioned about the obesity. So in TCM, how do we view this obesity as a factor? So in TCM, the spleen is the organ, is a concept organ that produces qi. It generates blood so that the blood can flow through our body, and it distributes the food and fluid throughout the body. This keeps our organ nourished and able to receive nutrients and function normally. So in a lot of cases in obesity, some due to a harmful, unhealthy diet, it may cause a hurt injury to our spleen. And this leads to the stagnation of the qi in the spleen. So the qi production cannot be produced. And also these food particles cannot be distributed equally throughout the body, and as such, they accumulate as a fat. So for those who are obese, we call them having a 痰湿体质, a kind of body constitution where the body is filled with phlegm accumulation. So this phlegm may surround the reproductive organs and result in the reduced qi flow. As such, the conception is harder. So it also applies to it's not just for the ladies, for men as well. For men, an enveloping of this qi around the reproductive organs prevents the production of healthy sperms and the normal function of a reproductive organ. So obesity is a very important factor. Okay, let's take a look at another factor. So a lot of you have heard TCM, traditional Chinese medicine. We always say, oh, don't drink cold water, or 不要喝冷水. What does it got to do with this reproduction? So in traditional Chinese medicine, this cold have a characteristic feature, which we call it 寒主收引, which means in English it means like constriction, contraction. So these are cold. When experiencing cold, our muscle, our organs will feel tense.
So physician Tan, does it also mean like it restricts circulation in a way?
Yes. So it just imagine it's like, let's say if your blood vessel is a muscular wall, muscular tube, and the contraction, it will limit the flow of blood through our body. So it reduces the blood circulation in our body. So in the long run, it may lead to a stagnation of blood and the qi flow. So eventually, if let's say it is not well taken care, slowly this clot may form. In this traditional Chinese medicine, we call it 血瘀. This clot may choke up the reproductive organs in the female as well as male. Yeah, so that's why sometimes even though it is a pleasure to drink cold water, sometimes we have to limit the control, especially for those females with menstrual cramp issues. The moment you take in the cold water, it will worsen the whole thing because the muscles just squeeze tighten. Yes. So it is often, and this stagnation or this reduced flow of qi accumulates more of the phlegm and affects the flow and fertility and the nourishment to this reproductive organ. So let's take a look at another next one, which is our kidney. So this is a very, very important concept in traditional Chinese medicine, as most of us have heard of this qi xu, shen xu. Shen xu is the concept. This kidney in traditional Chinese medicine is not the kidney like those that we filter all the waste material away and get rid of the body. In traditional Chinese medicine, kidney is an organ concept that controls reproduction. So if your kidney function is weak, you are unable to, the circulation, the qi around, and the quality of those movement for female is the menses, and for male is the production of sperms, all those will be inadequate. And this because this qi cannot flow through and the nourishment cannot occur. And we have this thing known as the kidney essence. This is the shen jing, which is the one that causes fertility, increase the fertility and nourishment, so that the sperm and the egg are able to meet with an adequate amount of energy.
Does this affect both male and female then?
Yes. For male, female is usually when the shen xu, usually there's a lot of menstrual problem issues behind it, and also have so backache. And for male, sometimes it also, in severe cases, then there may be like erectile dysfunction, or even sometimes the quality of sperm may not be good enough to reach the egg in a female's body. This shen xu applies for both male and female. So it's not restricted, like say only female gets shen xu or male gets shen xu. It's in human in general. So without this ability of the shen qi to hold the strength, and also for the implantation of the fetus, miscarriage also may occur easily. So with this in mind, let's take a look at how TCM treats this kind of issue. So we have understood the roots behind this infertility and these issues. So let's take a look. We have to solve this problem. So first thing we look at is if those who have like obesity issue, it is good that they start to change their lifestyle and also eating habit, because getting rid of this phlegm may help to improve the circulation of the blood and qi to the reproductive organs, and it may help. So for those who are interested and trying to improve the body to improve their fertility, they may go for like natural slimming methods, also those healthy methods. It's not like you're going to starve yourself or just or taking some maybe poor habits or other like beef slimming myth, which you read out from those websites or something. Yeah, go for professional help. So you may go and seek help from traditional Chinese medicine physician. In fact, traditional Chinese medicine, there's also certain herbs and natural supplements that may help in slimming. So you can talk to herbalists at the established TCM, modern TCM establishment, or just seek help and benefit from this. Not only does this slimming process help in fertility, but also improve the body, general well-being of the body.
Yeah, I think it's like beyond the reproductive system. There's TCM that's able to help address other underlying issues that can actually affect fertility as well.
Yes, in TCM, we take it the whole body as a whole. So this comes to the next point of weakness. Those body weakness, usually for those with may go back to the previous those body weakness, they may go for certain supplement or go check for the body checkup or visit have a body assessed by TCM physician or speak to those herbalists from modern TCM establishment for advice on what kind of herbs they can take that suits the body. It can be like the black bone chicken is also good for the blood and the qi and cordyceps. And also for those with a menstrual issue, it is good to control. That means regulate and improve your menses, because a good menses improves the fertility of a woman.
Yeah.
Okay, and
yeah, I think a lot of women do have a lot of issues with the menses, so that's something that many people don't think so much about. It's just clot, right? So I think seeing an expert could definitely help a lot. Physician Tan, we're gonna have to speed up a little bit.
okay. Yeah. So also for those who like to drink cold water, all this, remember, change your habit. It is, I know that in Singapore it's very hot, so a lot of them tend to drink. So try to cut down or minimize. Or actually, in fact, if the weather is too hot, you can just take in like those normal room temperature water. Yes. Okay, let's talk about those how another issues that a lot of people ask, like whether stress affects the fertility.
We're moving on to the next slide. Yeah.
Yes. So yes, it's very important. So as a lot of people, like once we are trying to get pregnant, or we are feel eager to, or you keep trying, and the stress starts to build up. But it is important to take note that actually this stress may even affect the fertility. So try to relax and take it naturally. Don't let it be a burden or a chore. So in traditional Chinese medicine, this liver is the one that controls our emotions and regulation of qi. So if you, let's say you are very troubled over pregnancy, keep trying, but couldn't get it, this stress may lead to the stagnation of qi in the liver, and this will limit the flow of the blood and qi to the reproductive organ, and it actually, in fact, worsen the situation. So try to relax and speak to your gynae, or if you are traditional Chinese physician, you have seek advice from them, and get yourself relaxed, and let nature take its course.
Thank you so much, Physician Tan. Yeah, I think sometimes we do have to seek help before it's a little bit too late. All right. So, there's still a lot that we want to hear from people who have experienced it firsthand. But before our panel discussion and us getting the answers, some of the burning questions that you guys have answered, let's just let you guys try your hand again at winning the, I don't know how many have redeemed already, but only the first 150 of you guys do get to walk away with a goodie bag. So do make sure that you scan this QR code, and you can actually receive a very nice goodie bag from our kind sponsors. So thank you so much for staying till this point, but you have to still continue staying on, because we still have the $50 Shopee vouchers. All right, we have 6 lucky winners who are going to walk away with these $50 Shopee vouchers each. All right, I believe it's a no minimum spend shopping voucher. So stay tuned, because those six names, people who have been staying with us all this while, thank you. All right, your names will be coming out towards the end of the webinar. All right, so let's start out with the panel discussion. All right, before that, okay, I do want to just introduce once again myself, Dr. Roland, Physician Eric, Kimberly, and Rohaida, who are speaking today. So we're gonna now have our mother of 2 boys, Kimberly, to share with you her story. Over to you, Kimberly.
Hi everyone, my name is Kim. Okay, I'm actually in my late 30s. I actually didn't have problems conceiving at the start. So I had 2 boys, and then, however, in the last 4 years, we realized that we started facing a lot of problems. And so we had a miscarriage where the baby didn't have a heartbeat. And so unfortunately, it was a horrible experience. And then subsequently, we realized that my husband had male issues. So we did 2 IUIs and 2 IVFs before we realized that I also suffered from low AMH, severe endometriosis, adenomyosis, and as well as a defect in my uterus. So since then, I've gone for surgery, and I'm just waiting to continue my journey. But in the meantime, in 2020, we also started Fertility Support SG because we realized that there are a lot of couples going through this, and it's a very lonely journey. Therefore, we started this as an Instagram group, and we offer support. Sorry, we talk to doctors like Dr. Roland, as well as show real life stories of different ladies going through. So do join us.
Thank you so much, Kimberly.
No problems.
All right, so let's welcome Rohaida, who's also a mother of 2 boys, right, to share with us her story, right? So Rohaida.
Hi, thank you everybody. Thanks, Dawn, for the introduction. So my name is Rohaida. I am 34 this year, and my journey started basically on this infertility is when I got married at 24. That's quite young. But after 1 year of actively trying, we didn't get lucky. So we actually did all the fertility checks, and I even underwent the procedure to actually look whether or not my tubes were blocked, and all of that were cleared, and we were able to actually we were asked to conceive naturally. So when that didn't happen, we actually explored other means, with a lot of hearsays, a lot of advice. We went through TCM, we did acupuncture, and we started conceiving naturally. That was after about 4 years of marriage, and then unluckily for me, that ended up in multiple losses. I had natural miscarriages, and at the same time, my last 2 miscarriages were actually ruptured ectopics. So basically, my fallopian tubes ruptured, and I didn't have any, so I had to undergo IVF as my only means to conceive, and I actually did IVF at the age of 29, and through the IVF procedure, I was able to actually garner about 7 embryos, 7 blastocysts at the end of the cycle, and through that I underwent some frozen transfer in 2017 and 2019, and through that I actually am blessed with 2 boys. So like Kim said, we are actually a group of women fertility warriors who knows that actually the pain of going through this journey, and really our coming up with this initiative is a pure passion project, from all of us, and we hope that having our presence here will be able to guide and also help anyone who's in this journey as well.
Oh, it's very, very heartwarming. Thank you so much again, Kimberly and Rohaida, for setting up this support group. So head on over to Fertility Support SG and start making friends there. All right, and building your support pillars, your support structure in getting through this journey, right? That's the reason why you guys are here. So thank you so much. And for myself, I shared earlier, I didn't have it easy. In fact, I suffered from Pcos, Polycystic Ovarian Syndrome. I was given oral hormones to take for a number of years. Yes, eventually I did have kids, but I was also worried about my fertility because I've undergone multiple C-sections, not by choice. It was because of emergency that I had my first and second C-section. So that's kind of like how I found Dr. Chieng, right? So yes, it could be a concern as well, like with multiple surgeries, right? Is this going to affect your fertility as well? So find out from the experts also, just to set your mind at ease if you're trying for subsequent births as well. Just like how Kimberly and Rohaida shared, sometimes the infertility might set in after you've had kids, right? So what do, right? You don't assume that you're fertile after you had kids, right? Things can happen as well. So we do have quite a number of questions. Thank you so much, everybody, for putting all your questions out here for us. So just to be mindful about the time that we have, I'm just going to set a few questions out here, right? So firstly, this is directed to Physician Tan, okay? So Physician Tan, are you able to share, can you recommend what vitamins can help to strengthen men and women, or what kind of herbs can help to strengthen men and women to take to improve their chances of conception?
So for traditional Chinese herbs, you have those those that can help improve the spleen function, the kidney function, and one of such is a heritage formulation, which is what you mentioned is it is passed down from generations, like the bak fong, which I think most of you have heard of. The bak fong is good for the improving the menstrual health of ladies, and for guys we also have this traditional classic formula, Those are recorded in an ancient classic, which is used widely for improving the strength and the well-being of not just men, female as well. The kidney qi, which is the 六味地黄丸. This is very good for improving the kidney qi and help in improve the vitality of general health of the well-being of an individual.
Wow. So I hope you guys were taking notes.
Yes, this can be, you can get it from a modern TCM establishment. It's very common in Singapore.
Thank you. And the next question is directed for Dr. Chieng. So Dr. Chieng, in this modern time, what are the biggest causes that are leading to infertility? Because the age profile is one thing, right? Where people start trying to have kids at a later age, right? So, but what about the other causes that can be causing the younger age group to have an issue these days?
Well, I think apart from the three main causes, the male factor, ovulation, and also pelvic factor and the fallopian tube, I think we are increasingly seeing more and more unexplained infertility. Unexplained infertility now probably can come out to about 40-50% of all consults.
Wow.
So whereby, if you look at them, they have all their tests done and then all the tests all return normal.
Just mystery. This is not the time yet. The stork is not coming yet.
Yes.
So don't give up.
Yeah. So what do we do? I think one of the questions we're asking about, what do we do with unexplained infertility? Now, the guidelines for number one, first of all, unexplained infertility is a real entity. It is a real entity. It's not because you do not know what's going on, and so therefore you come out with that. So it is a real entity, and lots of reviews has been done, and there are actually initially 3 recommendations for unexplained infertility. One is try longer. Now, it doesn't apply to everyone. So if you are already close to 40 years old and you've been trying for 5 years, probably try longer doesn't work. Number 2 is, you do SOIUI, super ovulation and intrauterine insemination. However, I think over the last years, it has not been found to be very useful because the success rate is really quite low, and it is not much better if you compare to spontaneous conception. So, of course, the third one is really IVF. Now, the other thing about unexplained infertility is that in IVF, we tend to discover or uncover a little bit more issue with unexplained infertility, whereby, things like poor egg quality, poor embryo development start to surface. So it can be a concern, but by and large, I think it's probably where we are. I think we are in a first world country. Things are getting difficult, and everybody is all busy. Yeah. So that could be one of the main issue too.
Okay, thank you, Dr. Chieng. I think, this question, a lot of the questions that you guys sent in were directed to the 2 experts, but you know what? We should definitely hear from those people who have gone through all this. So this is directed to you, Kimberly and Rohaida. It's more of a emotional and a mental kind of a state of mind that you had. I think you are both warriors, okay, doing what you do, even after having those mountains put in front of you, you still overcame it. What would you advise to people who are, they know that there's something wrong, okay? What would you advise to them?
Rohaida, you want to go first?
So after going through multiple losses and being told that you're really infertile, right, is in your face right now, I think what you need to actually do is to make sure that you're in a good mental space before you even take the next step. And to prepare yourself really mentally hard, yourself and your spouse, when you want to undergo this journey, because you have to be very sure that you are very well supported by your loved ones. And if you need all the time, maybe not all the time, because time is of the essence, but if you really need to have that few months, to recover yourself physically and also mentally, do so. Try to explore other means, and also and I know that this journey is not really very straightforward, and it can differ from individual to individual. The other thing will be the reality of us in Singapore is that we all are in a working society. I think the honesty that we have to have with our employers really makes a difference, because that journey itself will be quite emotionally draining and can be additional stresses to our physical body as well. So if you could just be very frank with your working environment, and then if to get the support from them, that will be ideal.
Thank you, Rohaida.
To just add on, basically, I mean, it is a very lonely journey. Support is very important. So you and your spouse have to be on the same page of what you want to do moving forward, because if one person wants to try and the other one doesn't, it's something that you can't do by yourself, and it's very important to surround yourself with people who will support you. As you are trying to get pregnant, people around you are getting pregnant. And so for your mental wellness, it's sometimes good to shut everybody out, just concentrate on yourself and what is best for yourself.
I agree. Surround yourself with the like-minded ones instead of the naysayers. Yeah.
Exactly.
Thank you, Kimberly and Rohaida. Okay, next question we have here is directed to Dr. Chieng. So how many times would you encourage somebody to go through IUI or allow them to go through IUI before moving on to IVF?
Well, it is not really the number of times you have to go through, but of course, generally, if let's say the indication for IUI is still okay, I will usually recommend for at least 3 rounds. But I will be very careful on that because, going through IUI compared to going through IVF, I think the amount of stress that you have to go through is rather similar because you will be waiting for 2 weeks for your result. And then while in the waiting process, you tend to forget what you're gone through. You're waiting for the same thing. So most of the time, I would like to make sure that the indication for IUI is still valid. In fact, halfway through, if it is no longer valid, I will encourage our couples to go for IVF instead.
All right. Thank you, Dr. Chieng. And this is directed for Physician Tan. Somebody asked, is acupuncture able to help with PCOS, Polycystic Ovarian Syndrome?
Acupuncture may help. It depends on the individual. So it is good to get a TCM physician to assess the body because different people have different body constitution, and what works for some may not work for others. So it's best to get it assessed by a certified TCM physician from established, well-known TCM establishment.
Okay. Thank you so much, Physician Tan. So just a question again for our panelists. Would you guys do you try both? Was it just like a Western medicine or like did you try TCM or did you just try everything?
I think when you're desperate, I think you're desperate, honestly, I've tried everything. I've tried TCM, I've tried acupuncture, TCM medication, hijama, which is the Malay form as well. Honestly, everything that I could try at that point in time, I did. I think when you're desperate, desperate measures come into place. But but I do think that ultimately the final thing was to go to a fertility specialist and get checked, because I think after trying so many things and honestly spending so much money, I realized that the fertility specialist was the one who told me my actual problem and managed to help me solve it pretty much.
Wow. And then Rohaida, did you?
Yeah, pretty much went through the entire thing as well. I agree. At the end of the day, it's you need to just go straight to the point and address what is the actual issue and how we try our best to actually overcome it. And of course, for myself, it was a straight cut. But it's totally real, and I can assure you, a lot of other women and couples out there are also probably on the same journey as well.
Yeah, I think we had this discussion also earlier. Like is it mutually exclusive? If you go through the Western route, can you still go through the Chinese route? Actually, you can do both at the same time. And you see these 2 success stories have also shared that they've done everything. Okay, so don't feel like you have to just follow one route. Okay, if both work, why not? You have a higher chance, right? So do the TCM, work with other issues like obesity or other underlying issues, and also work with a fertility expert to address the very scientific stuff. And you have a much higher chance of success as well. But let's hear from the experts, right? So Dr. Chieng and Physician Tan. Well, I guess we'll start with Dr. Chieng first. Yeah. Do you have a lot of people coming to you who, they're going for TCM at the same time while they're coming to see you?
Yeah, to me, I don't think there is too much of conflict because I think the TCM side has a huge benefit in terms of psychological impact. And I always emphasize on our patients that when you are going for IVF and all that treatment, you need to be extremely calm. So I think that, if let's say that calmness can be obtained through TCM and whatever, that could help to maintain your body balance, constitutions and all that, you will be beneficial.
Okay, thank you, Dr. Chieng. And what about Physician Tan? What are your thoughts? Do you have a lot of people coming to you while they're undergoing Western treatment?
In fact, TCM, we see the human being as a whole. So everything that's balanced, it will improve fertility and improve not just fertility, the general health as a whole. So for us, we will have to boost, like not just it can be the qi, the circulation, and how strong we are. And once our whole body is balanced, the yin and yang is balanced, everything can work. Yes.
I think that's really good. I mean, working with the body, or you said, you see it as a whole, right? The whole body. I think if you're successful with whether it's IUI or IVF or whatever treatment that you're doing at the hospital, you still need a very strong body, right, to carry it through, right? So I think using TCM to help to address other issues of the body as a whole can also help us to be able to carry through the pregnancy and even after, right? Having that energy to be able to look after somebody new in the family. So just making sure that everything comes together to make it a successful and more memorable journey on a positive note. So thank you so much. So we do have a lot more questions. This one is directed for Physician Tan, okay? How can TCM help with male fertility? Like, is it food? Do they have to do more sports? What can they do, from a TCM angle to improve fertility for males?
For male, actually, just now what was mentioned, sports is also good. It can improve the stamina. But also for male, most of the time, depends on what kind of condition, if you are saying, if let's say you're going to say it's ED, erectile dysfunction, or the weakness of the sperm, all those, you can boost, the main thing is to boost the kidney qi. It's more on the improving the strength. So you can go for herbs that improve the kidneys. There are a couple can be like cordyceps, also, and other herbs is like can be like Wang Jing, the Soti, all those, and also sometimes, but all this you have to varies on the how the body, individual body, the body constitution. So it's best to speak to a certified herbalist or a traditional Chinese physician from a established TCM institution to for better advice.
Well, definitely go to a reputable one. I think Yurin-sen is very well known. Okay, so you guys will be in good hands. One more question. I think this is so interesting, especially in this at the time that we are in right now. Dr. Chieng, I think you'll be our expert to answer this. Very keen to know this as well. Will contracting COVID-19 affect fertility? Not enough studies, right?
Yes. If you talk about medical evidence is never about over 1 to 2 years.
Yeah.
So I think from what we can see so far, I think nobody really knows how is the situation, but it doesn't seem to have any negative outcome. But I mean, what our advice is that there is no point testing it. Don't try. I mean, as much as possible, we all try to stay safe, and we do not want to be infected.
Yeah. Yeah, I hope somebody is doing this study right now. I'm sure there are studies being done right now.
Yes,
it's gonna take years.
Yes.
Yeah, but really interesting question. Thank you, whoever was asking that question. So I think we did address a lot of really burning questions that many of you had. Thank you so much for contributing all those thoughts and insights. And once again, thank you so much to our two experts, Dr. Chieng and Physician Tan for sharing all your learnings with us. And of course, to Kimberly and Rohaida for just being so open, so generous with your sharing. I think a lot of people will benefit from that. So, if you really want the raw deal, hearing it from people who have really gone through it, what they did, what worked, what didn't, okay, and just having somebody to talk to you who is on the same page as you, head on over to their Facebook page, all right? So I think you'll find a lot of kindred spirits there. And then also, thank you to all the sponsors, okay? I think there's so many people who have collected the goodie bags already. So I just like to mention all of the sponsors once again, the Platinum Part. Oh, wait, hang on. We have to announce the 6 winners also. Okay, so we saw that. We have the last time that we're going to flash this QR code right here for the 150 attendees. All right, sorry, the first 150 attendees who scan this QR code will walk away with the goodie bag. All right, so if you haven't scanned it, you want to try your hand again, please go ahead, take your phone out, whip it out, take this QR code, scan it, and then fill in the very simple form, and you will be able to receive the goodie bag, right? And then I hope that you guys are following the Facebook page or the Instagram page, sorry, with Kimberly and Rohaida. And then also, I hope you downloaded the guide for pre-pregnancy with Virtue's Fertility as well. Thank you, Virtue's Fertility Center. So you can actually find out a lot more information, and then also just head on over to the website for Yiren as well, and you can find out how much how better you can actually improve the current state of your health to improve your chances of fertility as well, right? So we do have a lot of excited people, I think, waiting to see who won the $650 Shopee voucher. Kimberly, Rohaida, did you? Oh no, I think we're out. We don't qualify. All right, so while we're waiting for the 6 names to be announced, all right, these are people who stay with us throughout. So thank you so much for hanging out with us all night. Okay, you have a little bit of a bonus right here. Okay, so you can go shopping after this. All right, Shopee doesn't close. All right, so thank you so much, and I do hope that you are able to share what you learned with your friends as well. Those who do need that little support or encouragement, whatever you learned from today, do share it with people whom you know will benefit from that, or direct them to the experts, direct them to the support group where they can actually hear, get a lot of people who are on the same page as them. All right, okay, so congratulations, we have the 6 lucky winners' names right here. Okay, so the 6 lucky winners, you have won this $50 Shopee voucher each. No minimum spend, so happy shopping. Email campaign@takeout.media. Just take a picture lah, okay? All right, but you have to send your name, your contact number, and you have 3 days. Okay, within 3 days, you've got to send your information, your name and your contact number to campaign@takeout.media to claim your prize. Right. So congratulations, Samantha Chiam, Farhana Nordin, Kijia Tao, Grace Po, Jack Chu, and Derek Guo. All right. So happy shopping, you guys, and thank you so much for joining us till this very end. Once again, I want to thank the partners. All right, so to Hydroflux, Yiren, who are the platinum partners, the gold partners, Dumex, Scott's, PCF, Sparkle Tots, Nature One Dairy, and the silver partners, Ministry of Health Singapore, Dove Baby, Virtus Fertility Center, and Prudential, and also the content partners, Center for Fathering, Mums for Life, Dads for Life, as well as Baby Pass. So thank you so much for making this possible. Also to MediaCorp and the Asian Parent for putting this together for us once again this year. All right, so to thank you all for the participation. All right, please make sure that you are all also signing up for the upcoming webinars, right? It's just so much to learn, okay? As a parent, I think that learning never ends. I'm still learning after so many years. So scan the QR code right here and sign up for that next webinar happening tomorrow. Yours truly is going to be there once again, talking about the New Moms Guidebook. So thank you so much, everybody, for your time and participation. See you guys soon.